The treatment for those patients with FAI syndrome very much focuses on hip muscle strengthening, so particularly strengthening hip extensors, hip adductors, abductors and flexors. Also trunk muscle strengthening is really important in those patients. But then I'll also really make sure I include some functional and movement control and balance exercises as well. We have an RCT that it's currently under review at the moment, where we found that patients did really well with FAI syndrome, whether you gave them a targeted strengthening program or a stretching program. So there seems to be an element of just getting the patients to exercise is as important as the specific type of exercise. Getting them to do general physical activity, whatever they want to do, which could be bike riding, it could be walking, it could be swimming, but really trying to encourage them to meet the physical activity, the WHO physical activity guidelines that say we should be trying to do 150 minutes of physical activity each week plus 2 strength sessions. So that's sort of how we treat FAI syndrome. And then if we think about hip dysplasia, there's a lot of overlap with what we do for FAI syndrome, but there are some specific things with hip dysplasia that you need to focus on that you don't focus on as much with FAI syndrome. Because if we think about FAI syndrome, the actual joint is it might be impinging, but it's quite stable. Whereas in a joint with hip dysplasia, the joint is quite unstable, particularly in the rotational activity. So when we're treating someone with hip dysplasia, we need to have our exercise focus on rotational stability as well of the hip, and also targeted strengthening, particularly of the hip flexors and the hip abductors, because those patients often don't have it. Their acetabulum might be too shallow laterally or too shallow anteriorly. So it's really important that they actually have big, bulky hip flexor muscles and hip abductor muscles, because they actually act like a wall around the hip joint. So strengthening those muscles is more important in someone with hip dysplasia than it is in someone with FAI syndrome. So and also giving that rotational stability and control, because the patients with hip dysplasia don't have that. So there are some differences between dysplasia and FAI syndrome.